I'm Zach.
I'm Sarah.
And I'm Blake, and we will be representing Olympus. So first off, to kick things off, who is Olympus? Olympus is a company that has technology, and it specializes in the camera fields, and it has audio technology, and it has scientific technology as well. But if we were to use a general label to describe Olympus, it would be that they are a medical technology company. That is where they focus. And for the purpose of this presentation today, we will be focusing on their ureteroscopes and their cystoscopes. Ultimately, Olympus's mission is to improve lives. How do we do this? We do this through our medical technology and the advances through that. We do not provide value directly to a common day consumer per se, but we sell medical technology to hospitals and doctors, and through that we are able to make people's lives easier with our more comfortable technology for the surgeries. So the main kind of trend that I'm going to talk about today is the main trend of disposable products. The two main disposable products that there are out on the market right now are Boston Scientific's LithoVue and Cogentic's EndoSheath. The EndoSheath is actually a product that's very similar to ours. The only difference between our ureteroscopes or cystoscopes and Cogentic's is that there is a little sheath that goes on top of it that they're able to kind of take off, just rub with alcohol, and then, prep it for the next surgery. So not really too much of a difference between ours, and isn't as much of a concern as the LithoVue. The LithoVue is actually a one-time use ureteroscope. And the argument is that the LithoVue is better because you're able to just do it one time, throw it away, and you move on. There isn't any sanitation, disinfection, or any processes with that, so the doctors are able to get more surgeries done. We have four main competitors that we monitor and are somewhat concerned about. Karl Storz and Richard Wolf are two companies which are actually offer a very similar product offering to ours. Karl Storz and Richard Wolf's are a much larger amount of products, but they aren't as high quality as ours. So ours have a very high level of resolution within the cameras, and Karl Storz and Richard Wolf, they don't necessarily have that, and we have a sort of competitive advantage over them in that sense. Cogentic's once again has the EndoSheath and that cystoscope, and Boston Scientific specializes in ureteroscopes and has the LithoVue, which is obviously a fairly significant concern that's starting to cut into our market share. And finally, we have our factors that influence selling that are important to remember. The personality of the salesman is super important. This is kind of the area in which personal selling actually originated. And because of this, personal selling to the doctors is super important. We have to kind of market to them, this is the latest and greatest and the best ureteroscope. You can do more surgeries with this, and it is giving you the best value. And that is the way that we look at marketing that. One challenge to marketing this is location and budget. So obviously, if there's a little small practice that isn't necessarily able to afford our higher end products, that makes it hard. And it's considerable to start looking at maybe some other product offerings because of that. And then of course, maintaining the relationship is super important in order to effectively market towards our consumers.
Next, I would like to talk about some of the new technologies that have hit the urology market over the past couple of years. In the past year, Boston Scientific has come out with the LithoVue ureteroscope. The closest product that Olympus has to the LithoVue is the URFV. They have very similar specifications. One of the biggest difference between the two products is that the LithoVue has a large outer diameter. This is important because it affects client comfort. The clients will be uncomfortable as the scope is inserted due to the larger outer diameter. Another big difference between these two scopes is that the LithoVue costs on average $1,350, whereas the URFV costs $15,000 per scope. Although that looks like a big difference, the reason that the LithoVue is so much cheaper is because the LithoVue is a disposable product and is only used once, whereas the URF-V is usually used on average about 26 times before needing repair. So if you add up, if you multiply the LithoVue cost times 26, then it costs about $35,000 to perform the same number of procedures as it does for the URF-V. Another product that has hit the market over the last couple of years is Cogentic's Endo Sheath. The Endo Sheath is a disposable sheath that goes over cystoscopes, and as soon as the surgery is performed, the nurse can just throw away the sheath. This is important because this means that users of the Cogentics no longer have to sterilize their scopes and don't have to do high-level disinfection. They can just wipe the shaft off with alcohol before sticking it into another sheath and performing another surgery. This saves them a lot of time and some money. Some of the strengths that Olympus has includes being able to meet many of the needs that their customers have. This includes cost, the ability to meet all of the requirements for specific cases, and high-end technology. Olympus has some of the highest end technology in the market, including 4K, narrowband imaging, and bullet-shaped tips to their cameras. Another strength of Olympus scopes is that their scopes have wide angulation ranges. This is important because when ureteroscopes go into the kidneys, they're able to angle kind of like a hook to be able to reach hard parts of the kidney where other scopes may not be able to reach. Another strength of the Olympus products is that they have bullet-shaped tips. These are modeled after the bullet trains and make it so that when the tip is inserted into the urethra, it expands the urethra slowly as the tip gets bigger going in. Another big strength that Olympus has is HD visualization. Olympus is able to provide high definition and 4K for specific products. Although Olympus has a lot of strengths, they also have some weaknesses. Some of their weaknesses include they're slow to develop new products. While many of their competitors are coming out with disposable products and higher end scopes, Olympus has just stood pat over the past couple of years. Although Olympus has some of the higher end quality products on the market, eventually their competitors will catch up. Another problem that Olympus has is that they're unable to meet the price needs of hospitals in lower budget areas. This is important because the only way that the sales reps can reach that market is by lowering the price of the scopes, giving them higher discounts, which leads to the company losing profit. Because the company is so large and profitable, they are able to acquire new technologies if they choose to. As the company researches products such as Cogentic's Endo Sheath, due to the fact that Cogentics is a newer company, if the company wanted to, they could look into acquiring that new technology or other technologies. Another opportunity that the company has is to produce cheaper scopes. Because the company only produces high quality scopes right now, like I said, they're unable to meet the needs of hospitals with lower budgets. This means that they have to discount, and if they produce cheaper scopes, then they could reach that group of people and add to their market share. Some of the threats that the company face, I have already mentioned. Most of those right now are disposable products. The disposable scopes, especially the LithoVue, they're currently more expensive than Olympus's reusable products. But in the future, that may not be the case. Now is the time for Olympus to make moves and either begin to develop disposable scopes or find a way to make their high-end scopes cheaper. Another threat are the disposable sheaths. Um, as of right now, while the company is doing research, the sheaths that Cogentix has produced so far, although they're not flawless, come with very few flaws. They're cheaper, and it reduces the need for sterilization and high level disinfection. So those are a couple of threats to the Olympus market share as of right now. Olympus's marketing objectives include the philosophy to help people around the world lead healthier lives, the value they put in creating quality products, and their mission to help create healthcare solutions now and in the future. This is what their marketing objectives are based on.
Some evolving needs involving Olympus's target market strategy include the need for high quality and accurate imaging, as well as lowering the pain that patients feel when surgeons are using our products. We're able to do this because all of our scopes have bullet tips that are shaped like bullet trains that lower the pain that patients feel. Olympus currently has a unique product that is needed in the medical market right now. Olympus provides scopes with a wide angulation range that is wider than a range that any of our competitors have. This gives us an edge when we are selling our product to our clients. The way we sell our products is that sales representatives will meet with surgeons and tell them what Olympus has and what we can provide for them that's in their budget. A potential problem that Olympus faces in the future is a lack of presence on social media sites. Olympus provides a wide range of products, however the focus is on our urology department. Our urology department provides some of the best endoscopes in the market. These scopes have high definition visualization, wide angulation range, as well as wide band imaging. Our scopes are showcased at trade shows, which allow our clients to come and view what is new in the industry and what Olympus can provide for them. All of our product is produced in Tokyo, Japan, which is also our headquarters. It is then shipped to our U.S. sales offices, which are in Pennsylvania, Massachusetts, and California. Olympus uses more of a pull market strategy rather than a push market strategy. Because our name is so well known that we don't always need to be pushing our name out, clients will recognize our name and know that our product is one that is made of high quality material. The biggest way that we promote our products is through sales representatives. Our sales reps will meet with surgeons in hospitals all around the country, and they practice personal selling. Oftentimes they will show our products in surgeries to show these surgeons what they can do and how it differs from the technology that they already currently have. This is useful because it demonstrates the technology, but also creates brand loyalty with our clients in the future. We also promote it again through trade shows, which allows our clients to walk through and see what's happening in our industry and see what Olympus can do for them. And lastly, through mail orders is another way that we promote our product. We use mail orders because it is a way to get our name out there and create that brand recognition. So the next time that a surgeon needs to upgrade their medical technology, they'll come to Olympus. In terms of our pricing, paying for an individual LithoVue scope is more expensive than the reusable scopes. Olympus does not really have any inexpensive scopes because our products are so high quality and made with such good material. Our prices do need to match that. That can be a little bit of a downside because that limits the market that we can reach. Olympus currently targets more of the high budget, and our competitors are able to produce products with cheaper material, which means that they're able to sell them at a lower price and are able to reach the market of hospitals and surgeons that do have a lower budget, whereas we target the market that is able to pay for the high quality products and the new technology, and the hospitals that do have a higher budget.